Good morning, everyone. My name is Riya Adhikari, and I am a registered nurse working here at the Sydney Private Hospital. I would like to acknowledge the traditional custodians of the land on which we meet today, the Wangal people of the Eora Nation. I pay my respects to all elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people. This in-service is about culturally responsive practice in healthcare, which is a key issue affecting health outcomes for Aboriginal and Torres Strait Islander community. This is aimed at us as clinicians to reflect on how we can improve the care we provide and ensure our services are culturally safe, respectful, and inclusive. Firstly, I would like to explain that health disparities remain a persistent challenge for Aboriginal and Torres Strait Islander people, despite ongoing reform and targeted healthcare strategies. The potential avoidable deaths by Indigenous people, as you can see in this chart, is 3 times higher than non-Indigenous people since 2010 to 2019. These include higher rates of chronic illnesses like diabetes and cardiovascular disease, higher infant mortality, lower life expectancy, and poor mental health outcomes as shown in this figure. It is comparatively higher than in Indigenous people in Australia. For them, health extends far beyond the absence of disease. It is a holistic concept of physical, emotional, social, spiritual, and cultural well-being of an individual, along with the broader community, and this understanding rooted in Aboriginal worldviews. These disparities are driven by issues such as intergenerational trauma, disconnection from land and culture, institutional racism, and a lack of access to culturally safe healthcare. It is important to understand what a culturally safe healthcare is to recognize and respect the values, needs, and identities of Aboriginal people and to support their determination while addressing the presence of power imbalance in healthcare system. Without such care, they may feel judged, unsafe, and misunderstood, which can discourage them to seek or continue with the care or treatment, and that eventually results to worsening healthcare outcomes. Talking about culturally responsive practice, it refers to a proactive, strength-based approach in healthcare that is relevant and respectful to the cultural identities, values, and lived experiences of the individual receiving care, and it goes beyond clinical competence. It acknowledges the profound impact of colonization, intergenerational trauma, systemic racism, and social disadvantages on health and well-being of Indigenous communities. As I discussed earlier, health is understood holistically by Aboriginal and Torres Strait Islander people. Therefore, culturally responsive care must include a whole person approach that honors their connection to the country, community, kinship, and culture. In Australian hospitals, many Aboriginal and Torres Strait Islander experience care that feel culturally unsafe, and I would like to discuss some of their experiences with you. There have been multiple reports of them being racially profiled into stereotypes. and discriminated often based on appearance, postcode, or assumptions about alcohol or drug use. Many also experience dismissive attitudes and feel they are not being heard or believed, which takes us to poor communication being one of the barriers. Healthcare providers have sometimes failed to explain diagnosis, treatment plans, and use accessible language, which leads us to lack trust, delay in seeking help, and worse outcomes. I would like to give you an example of our rehabilitation ward as an Aboriginal elder was admitted following a stroke a few weeks ago, and English was their second language. It was informed that they were comfortable speaking in their first language with support of family or an Aboriginal liaison officer. Whenever staff communicated complex care plans, medication changes, and physiotherapy plans, they were using complicated medical terms, and the patient would quietly nod without fully understanding. Later, the patient began missing physiotherapy sessions due to confusion and discomfort. Staff stated this as patient being non-compliant and care was delayed. Now, this is an example that teaches us how communication must be culturally and linguistically appropriate to ensure comprehension and patient engagement. Also, there are few institutional barriers such as interpreter services, limited interpreter services, lack of Aboriginal staff, and inflexible care protocols that limit the ways of providing culturally responsive care. With all this information we have discussed so far, I hope we have gotten an understanding of how, as nurses, we can uphold culturally responsive care by actively engaging in self-reflection, to perceive our own biases and how they may impact in delivering care, then learning about ongoing effects of colonization, historical trauma, systemic racism on Aboriginal and Torres Strait Islander people's health circumstances. We must also prioritize respectful communication, use uncomplicated language, and seek support from Aboriginal health workers or liaison officials to build trust and cultural understanding and further strengthen the patient nurse relationship. We should involve patients, families, and communities in care plan and respect their cultural preferences and values. That's a way patients feel comfortable to seek help through their families when needed. It is our responsibilities to listen attentively to our patients, act in humility, and shape our care in ways that make patients feel respected, safe, and heard. These approach support in achieving better health outcomes and restore trust in healthcare systems simultaneously. We are at the last segment of the in-service now, and it is about how we can all work together in implementing culturally responsive care at our own wards in our hospital. Implementing these strategies require us to be actionable and focus on evidence-based practice. One of the practical measures include ongoing cultural safety trainings. It needs to be Indigenous-led, reflective, and interactive, which lets us learn and unlearn continuously. We can make our hospital more culturally inclusive through environments Visible symbols such as Aboriginal and Torres Strait Islander flags, artwork, and welcoming signage can help them feel welcomed, respected, and valued from the moment they arrive here. Another strategy could be hiring more Aboriginal employees and encouraging Aboriginal candidates as they provide cultural advocacy and emotional support to the patients. Lastly, adhering to hospital policies and procedures to respect practices like sorry business, which is associated with cultural mourning practices and rituals when a loved one passes away in Aboriginal communities. It is highly essential to use culturally appropriate language and get consent for any processes or care to be respectful during times like that. To conclude the session, I would like to thank everyone for joining in. This can be our first step in bringing better practice for our Aboriginal and Torres Strait Islander communities. Let us all commit to continuous learning and advocating for systems that support equity, trust, and dignity. And please feel free to share any thoughts or suggestions regarding this in service with us. Thank you.